officials from Mbarara University of Science and Technology, representatives from Vellore Institute of Technology, our American friends from Massachusetts General Hospital, Harvard Medical School, and the Massachusetts Institute of Technology, our partners from Baylor, Uganda. Ladies and gentlemen, good morning. I truly regret not being able to be with you in Mbarara today for this exciting event. But I want you to know that I am with you in spirit, and I'm delighted and honored to be able to address you virtually with a little help from modern technology. And actually that seems quite appropriate, for it is technology and its application to the problems of the real world that brings us together today. Applying and adapting technology, encouraging innovation, and breaking down barriers between disciplines in the pursuit of new approaches to age-old problems is why we are here. And the problem we are tackling, and to which we are asking you to apply your skills, is one of our foremost challenges in the health sector: maternal mortality. In Uganda, and in many other nations, maternal and child deaths arising out of complications during pregnancy and childbirth remain a major concern. What makes this problem all the more compelling and frustrating is the fact that 90% of the complications that lead to death can be avoided when women have access to quality care, including prevention, diagnostic, and treatment services. The disparities in maternal mortality rates between countries in the developed world and the developing world are striking. 99% of all maternal deaths occur in developing countries, and 56% of those are in sub-Saharan Africa. And sadly, Uganda ranks near the top of this tragic list. This is why the United States government last year launched the Saving Mothers Giving Life pilot project here in Uganda and in Zambia as well. The project is focused on finding simple, cost-effective, and sustainable interventions designed to increase uptake of antenatal care and facility-based deliveries, and in so doing, drastically reduce maternal mortality rates, perhaps by as much as 50%. Many of the agencies which make up the U.S. mission here in Uganda, including the U.S. Agency for International Development, the U.S. Centers for Disease Control and Prevention, the State Department, and the Peace Corps, have joined together to implement the Saving Mothers Project, along with the Uganda Ministry of Health and our implementing partners funded through the U.S. President's Emergency Plan for AIDS Relief, PEPFAR. The project has had tremendous impact already, and in its first year it has helped us to put substantive actions behind our oft-stated belief that the day a woman gives birth should be a day of joy for her family and not a day of tragedy. We believe that we can and we must make a difference, and I'm hoping that all of you can help us to do just that. Through this hackathon, organized by the Consortium for Affordable Medical Technologies, or CAMTech, and hosted by Mbarara University of Science and Technology, we hope to find ways to sustain and expand the progress that we've made. We hope that this dynamic mix of clinicians, engineers, entrepreneurs, and end users can help develop technology-based solutions to the clinical challenges that must be overcome if we are to give mothers here the same hope for a productive and rich life for themselves and their babies that a mother delivering today at Mass General might have. Of course, mothers here are not delivering at Mass General. They are delivering in Uganda, in a clinical environment that faces serious resource limitations. So the question is, can you help us overcome these constraints and build the entrepreneurial capacity and develop the new technology solutions that can overcome the serious clinical challenges that put pregnant women at risk every day? I hope you can, and I know you are determined to try. This is why you are here, and I am encouraged by knowing that CAMTech's previous hackathons in Boston and India yielded overwhelmingly positive results, and I believe this event will as well. New approaches to old problems. Nothing is more exciting than seeing intractable problems yield to the energy and vision of intellectual partnerships like this. And I want you to know that the U.S. mission works every day to find innovative ways like this to work in partnership with Ugandans and to build a better, brighter, and healthier future for this nation. We strive in all we do here, particularly in health, which is a huge part of our assistance portfolio, to find sustainable, country-owned and country-led solutions to Uganda's challenges. And over the next 2 days, we will ask all of you, colleagues from far-flung places with different capacities and varied expertise, to come together to find such sustainable and effective solutions. Solutions that save lives and make people healthier. Solutions that will keep mothers and babies alive, that will keep families together, that will strengthen communities, and that will ultimately build a better and brighter future for all people. Thanks again to our friends at Camtech and to Mbarara University for your hard work and your determination to make this happen. And thank you to all our participants for your commitment, your vision, and your energy. I wish you the very best and ask you to work together, listen to each other, and learn from one another. I have no doubt that you will enrich the lives of the people of Uganda, and in the process, your own. I can't wait to see the fruits of your efforts. Thank you again. Good luck and good work.